All right, well, welcome back to this here at the 2021 Oregon State of Reform Health Policy Conference. I appreciate y'all filing back in the room. I can see on my handy dandy computer machine here, folks like Jen Inman and Maggie Bennington Davis and Ashley Lara and Brent Dahl and Patrick Heath and a bunch of folks, Amy Favre, in our metaphorical room here together. So even though we are not physically together, you should know that we're still sort of leaning into these conversations together, and we are super honored and just happy to help play this role in getting us all together, even if it's just in a virtual room. So without further ado, let me just jump right into our introductions of our keynote panel members here this afternoon. To start, we've got Senator Kate Libra, who is the Assistant Majority Leader in the State Senate. Senator Dick Anderson, the Vice Chair of the Senate Interim Committee on Human Services, Mental Health, and Recovery. Representative Rachel Prusak, who chairs the House Interim Committee on Healthcare, and Representative Raquel Moore-Green, the Vice Chair of the House Interim Committee on Behavioral Health. Thanks to each of you for making time. Representative Prusak, let me ask you, why don't you just give us a sense of who you are for people who don't know you? What do you do, and what kind of stuff informs the work you do in the legislature? We got you on mute still there, Representative.
Of course, we had to kick it off that way. Hello, everyone. Thanks, DJ, and thanks for hosting and having me here for the State of Reform event. I'm honored. But for intros, I am the state representative for House District 37. I am chair of House Healthcare Committee, as you mentioned. But what I think most important that guides my work within the committee is that I have been a nurse on the front lines for over 2 decades and a family nurse practitioner for over a decade. And over the last 2 years being on the front lines of this pandemic, I specialize in primary care, palliative care, and hospice care. And my patients are homebound, so they reside in long-term care, adult care homes, and in their own home. So really, saw up close and personal everything that occurred during this pandemic. And I'm thankful to be here and participate in this panel. Thank you.
Yeah, thank you. Representative Moore-Green, how about you? Give us a rundown of your biography and background.
Well, good afternoon, DJ, and thank you, and thank the State of Reform for hosting us this afternoon. As you said, my name is Raquel Moore-Green, and I'm a House representative for House District 19, which is South Salem, Turner, and Almsville. It's here in the Mid-Valley of the state. And for many years now, I've been a solopreneur, run my own business, just me, solo. And I think what I bring to the healthcare table, so to speak, including the behavioral health arena, is a business background. And what can help to make our systems run more efficiently, be affordable, and how can healthcare be delivered in a manner that access is available to all Oregonians, and that means our rural communities as well.
Thanks for making time, Representative. I appreciate it. And Senator Anderson, how about you? Give us a rundown of the kind of background, experience, and values you bring to the conversation.
Well, thank you, DGI. Yes, Senator Dick Anderson. I'm Senate District 5, which is actually on the coast from Tillamook to Coos Bay. So it's a broad piece of the Pacific Ocean and the Oregon coast. My background actually is housing, 35 years in housing. But what has shaped me for this Senate position has actually been my 12 years as local government. I'm a former mayor of Lincoln City, and through that lens, have seen a lot of needs on the coast and in our communities, and generally healthcare, behavioral health, housing, childcare are key components. And I've been fortunate enough to be assigned some great committees in the Senate, and I look forward, especially the healthcare and behavioral health arena, to add my perspective to the needs for Oregonians.
Yeah, thanks, Senator. And Senator Lieber, give us a rundown of your background.
Well, thank you, DJ. And I also want to echo thanks to the State of Reform for having all of us and my colleagues here. So I come at this slightly differently. I'm actually a former prosecuting attorney. I spent 8 years on the Psychiatric Security Review Board, taught at Portland Community College in the Criminal Justice Department for many, many years, and then was really interested in sort of the intersection of mental health and homelessness, and joined the Transition Projects, which is a board in Portland, Oregon that deals with homelessness. And those experiences really shaped this whole idea of looking at healthcare, and especially the behavioral health as a system, and making sure that system was as strong as possible. I was fortunate enough to be the co-chair of the Human Services Ways and Means Committee. So that's the budget writing committee. And through that work, I really took my background to sort of inform how we went forward this year with writing our budget.
I appreciate all of you. And this sort of four-corner conversation is, we just think it's the kind of stuff that we should be having a little more of in the world today. So I appreciate you all making time. Also, for you in the audience, don't be shy. You're not usually a shy bunch. I know many of you personally. So go ahead and ask your questions. You can do that through the chat box here on the side, and upvote those, prioritize those that you want to make sure are integrated in the conversation. And I will get those woven in as we can best do so. So Senator Lieber, let me start with you. Give us a rundown of what you're spending your mental energy on these days when it comes to healthcare, to health policy, and health reform.
Sure, thank you. Well, COVID has laid bare so many problems in our system, right? I mean, in the healthcare system in particular, I think that we all knew that these sort of problems were in the system and people were working on them. And COVID just basically said, you're out of time. We've run out of time. The problems are right here in front of you. The thing that I've been really wrestling with quite recently, and I'm sure everyone in your audience is too, is the workforce issue, right? Workforce is the immediacy of our workforce crisis is quite frankly something that I'm not sure I anticipated, and I'm not sure a lot of people anticipated, just the ferocity of the nature of it right now. And so the things that we're really trying to do, and in not only sort of in the behavioral healthcare workspace, but long-term care and other sort of settings, is to really stabilize the workforce that we have, or we're not going to have a system to invest into, right? So those are the kinds of ideas when especially the immediate. Longer term, really, it's really about talking about healthcare for the whole person, about integrating behavioral health and physical health in a way that hasn't been integrated before, and really thinking about these things that when we talk about social determinants of health, and I know Senator Anderson will touch on this around housing, it's a social determinant of health. And I know that Representative Prusak will talk about her work as just on the ground on what she's seeing with regard to healthcare. But it's going to be about how do we make sure that we are doing value-based payments, that we are paying for the right things, and that we're actually treating the whole person. Because people don't just come in with an appendicitis. They come in with all sorts of other issues that we need to work on making them better. And in the end, I think it will cost our system less.
So Representative Prusak, as you're thinking about some of these topics, workforce, as a member of the Oregon healthcare workforce, how do you see sort of the CCO model extending beyond Medicaid into the commercial market, into OEB, PEB, maybe even farther? Are there tools in that CCO model that can be employed beyond Medicaid when it comes to things like workforce and some of the other topics that Senator Lieber has mentioned?
Well, I know that we are looking at this space with a Medicaid waiver. How can we push the boundaries of what we can use? How can we use money in flexible ways to address the social determinants of health? But one of the things I want to highlight that the senator mentioned is this workforce issue. It is such a critical need. And I think we need to start with changing the current work culture from a stressed, compressed environment to one that is team-based, supportive, and resilient. And maybe the CCOs can engage on that. The administrative burden that is put upon clinicians, the complexities that are put upon patients accessing care. I think that is another thing that we need to look at, because the effort on workforce is going to take all of us, everyone invested in healthcare, not just the educators of nursing, but the payers, the hospitals, the community colleges, the universities. And we need to address the education bottleneck and the need for an education pipeline that encourages students to get involved and inspired to move up the ladder. And we must look at varied solutions, including debt relief programs, outreach strategies, and increase access to training programs. And because of this issue, I have convened a multi-stakeholder workforce work group specifically focused on nurse wellness and pipeline issues. And I'd say I really hope that the CCOs, while they are payers and while it might not be what they've looked at historically, it's going to take all of us. Yeah. But the one factor that I think they can address is the social determinants of health and how we use dollars more flexible. And I know we passed a bill in the last session to make that easier. And there's a Medicaid waiver group really looking at this. The CCOs are engaged with the Oregon Health Authority, and really hope we do push the boundaries. We need to think outside the box and how we can be creative.
For those of you keeping score at home, that question I asked was a huge, big, hairy one, and Representative Prusak knocked it out of the park with a thoughtful response. So thank you, Representative. Senator Anderson, let me ask you to build on this social determinants topic. You've spent a lot of your career working on housing. How have you found topics of housing as you have begun your career in the legislature? How have you found those to be teed up? How have you found those to be integrated into the healthcare conversation? Anything that surprises you so far in your experience in the legislature?
Well, thanks, DJ. I would have to say a lot of things have surprised me, quite frankly, in my first long session in the legislature. And probably, I better stage this correctly, that, I'm coming through a lens of, rural, coastal, local government, 12 years of local government, and kind of view things from that perspective. And not to say that we've gone without, but we don't feel we've got a lot of the resources and assets. And so, my mission really was to get the economy rolling. And I saw and identified housing as a big barrier, lack of, then childcare. And Senator Libra indicated with COVID, that certainly, came out of the blocks. Healthcare. And it started dawning on me that it wasn't just, the economic development or lack of, but, the whole healthcare world was impacted as well, because as we were speaking earlier, if you don't know where you're sleeping at night or living, how can you be really healthy? And it's a problem. But I found the discussion around housing, as caring as it might be, we spent time filling buckets of money, and not really, in my opinion, identifying opportunities and barriers to create more housing, because what we have is a lack of. Certainly affordability when you don't have the product is the issue. And I'm hoping to back it up and get the barriers out of the way to get more product and different types for all means, so that up and down the coast and certainly Oregon, housing can be there. And I've identified some things, and certainly I'm fortunate to be on a committee, housing committee in the Senate, where I think that's the next step, is we'll identify some barriers and make some real progress there. But they are all tied into our overall healthcare, behavioral health. This all is interconnected.
Representative Moore Green, as you bring your business background and acumen to this health policy conversation, I know other legislators have have expressed frustration with the complexity of healthcare. Frankly, other healthcare executives have expressed frustration at healthcare. How do you try to apply the values that have worked for you as a business person, an entrepreneur, to a complicated set of topics related to health policy? How do you sort of bring your knowledge to that complicated web of discussion points?
Well, thank you for that question, DJ. I would have to say that looking at allowing each community to look at how they operate in their own unique way, whether it's the communities to the north of us, being here in the Valley, the Portland area, what works best for that neighborhood or that community. On the coast, are our neighbors across the mountains, what is going to work best in that rural community? And I think I like to brag on Salem Hospital, and actually I'd like to brag on all the hospitals and the stellar jobs that they have done during this pandemic. They have really stepped up to the plate and done some marvelous work. Specifically here in Salem, how does our community want to receive their health care? And how can we streamline regulations and restrictions that inhibit access, that complicate, as Rep. Prusak was stating earlier, some of the billing that goes on. So I would look, I try to look at it from the standpoint of if it was my business, how could I make it more efficient? And I do think local communities speaking into that, and not one size fits all. For instance, when it came time for vaccinations to be distributed, Salem Health decided, working with the local businesses and our local county health here, they came together, collaborated, and decided that the best way for our community to distribute vaccines out the gate was a mass vaccination center at the state fairgrounds.
So, Representative Prusak, one of the things I'm sure you hear when local folks like Representative Moore-Green is referencing, when they come to the legislature, they're often asking for more money and asking for more resources. One of the advocates who has often come to the legislature is Becky Holtberg. She's the CEO of the Oregon Association of Hospitals and Health Systems. She was a guest of ours here this morning on the morning keynote. One of her comments about the legislative process and state government at present is that there seemed to be kind of this lack of a comprehensive vision for where health policy should go. I don't think she meant that as a plus or a minus, a slight or a, wasn't bad. It just sort of was an observation. I'm wondering if you were, able to at least set the agenda for all of the legislature. I won't ask you if you were a queen for a day, but if you set the agenda for all of the legislature on health policy, what would be the topics that you would regularly tee up if politics were not a consideration?
That's a great question. Let me start with what we did in the committee and how we focused in 2021. I had to look at the date because the year has been crazy. More than 150 bills were referred to the House Healthcare Committee. It is a very busy committee. Representative Raquel Moore-Green is on there with me. So along with my committee and of course advocates, whether that's, hospitals or those advocating for, universal access to care, I prioritized with my vice chairs and committee equity, access, cost, and public health. And every bill that came, I would use that as a frame. And so I think if we continue to frame that as we move forward with a vision, then we can continue as a state to move towards universal access to affordable, culturally appropriate healthcare that includes mental health care and behavioral health care. I can highlight a few of the bills. I have 3 that I love to share with that, those themes in mind to work towards that goal. But before I do, I will say one of the things that I've been thinking about, and some might think it's a bit controversial, but I have not been able to hold an informational on this topic because in June, my committee was closed for floor session, and then September, some stuff with redistricting. But I wanted to hold an informational on what our Oregon Health Policy Board does and how potentially the legislators could work more closely as we work towards this transformation. And I don't know if it will happen for November Ledge Days because we have to set up February, but it is out there. How do we work together? Because I think what she mentioned, a lot of people will say is we kind of have these silos and a lot of different people are talking about it. I mean, I hope the healthcare committee and the behavioral healthcare committee and the COVID subcommittee work together. But sometimes a lot of people are doing a lot of different things. And if we really want to have that transformation, we have to stay focused. The three bills that I'll highlight to kind of keep that lens, and I think what we need to do moving forward, and these are bills that states are looking at Oregon. They want to pass themselves. House Bill 3351, Cover All People, which expanded eligibility to adults who would qualify for Medicaid if not for their immigration status. Our immigrants are important community members who have been on the front lines of this pandemic, especially in our agricultural, manufacturing, and healthcare workforce. House Bill 2508, one that I prioritize, which expanded coverage of and reimbursement for telehealth services, promoting equitable and safe access to care, including mental health care. And again, we keep saying how the pandemic highlighted the inequities in our healthcare system. And we know when we have the data for specific marginalized or underserved communities, we can proactively combat the biases deeply impacting the health of Oregonians. So we passed House Bill 3159, requiring healthcare providers and insurers to collect data on race, ethnicity, preferred spoken and written languages, disability status, sexual orientation, gender identity, if the patient's willing to provide. So these three bills, I think, help with that transformation. And if we continue to prioritize equity, access, cost, public health, and all, come together and have these conversations, we will continue with that transformation.
Out there. Sorry to interrupt, Representative. Did you want to keep going?
No. But now it's out there. The plans for the Oregon Health Policy Board that the chair of the Healthcare Committee hopes that we have these conversations that she brought up this morning.
Yeah. Well, Kimberly Valdez, one of our attendees, says in all caps, yes, exclamation, 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 thank you. I'll just add that there. And Senator Libra, I'll give you this question from Sam Metz. I will modify his question a little bit, but I'll read his question and then let you go where you would like to go. He says, the U.S. House is considering federal enabling legislation that, if enacted, would permit Oregon to direct the multiple sources of federal healthcare funding into a single statewide pool. Would this concept help Oregon create a more efficient healthcare system? And so my reframing of that, and you can answer his question or my question or something in between, would that deal be of interest to budget writers and policymakers if all of the federal funding for Medicare, for example, were to flow into Oregon's budget coffers in exchange for Oregon managing the Medicare program as it manages Medicaid? Would you want to have that kind of deal, or is it better to let Medicare stay separate so that it doesn't mess up the good stuff that Oregon has going? What do you think about that?
Well, I mean, I think that is a really interesting question because my first question back would be what strings are attached to that, because there are always strings from the federal government that you may or may not want. I also think that the more that we can make money flexible on how it's spent so that people who are on the ground doing the work are able to invest it in a way that makes sense for them instead of prescriptively from on high, I think that would be a really huge value add, which is why we're going to this value-based proposition around the CCOs and CCO 2.0. So those kinds of, so I think that the behind the question is, does it make it more flexible for us? Then I'd say, yeah. What are the strings and can we live with them? Would be the sort of follow-up question as a budget writer. But I think that's a really good way to think about how we're looking at healthcare now, right? Healthcare and money and all the things that go into it are super siloed. And I think your introduction and stuff you had mentioned to us prior to this, that sort of you have people in this room, in this virtual room, that are sort of in these silos. And unless we work across the silos, we're not actually going to make progress in the system. We have focused on silos for too long, and we need to start focusing on this 100,000-foot level of the system, because the minute you pull the lever on one side of the system, you are affecting the other side of the system. And unless somebody is thinking about that in a really profound way, I think we run into the problems that we have, which is everybody's just advocating for their own little piece of the pie and not looking at how we can really transform it. And so I love the idea that Representative Prusak is using in her, I wrote them down, the equity, access, cost, and public health. I was recently at another conference where they talked about the iron triangle in healthcare, about being access, cost, and quality, and you can only do two out of the three, right? I mean, unfortunately, that's part of the problems that healthcare entails. And so how do we take this very complex system, dealing with the complexities that people have in their lives, right? People are very complex, and make it sort of work in a way that makes more sense. And that's, as we sit here in the legislature, that sometimes is really difficult to do for a legislator who we have 3,000 bills coming into the long session, and trying to sort of make sense of that. So the system itself is going to have to make some changes that need to help with this. I'm focusing on the behavioral health system. I talk about this system, when Senator Anderson talks about housing, it's absolutely, we don't have enough of it, right? But housing isn't the answer. When we talk about behavioral health and those kinds of systems, we've got to invest in mental health and substance use disorder, right? You can't treat somebody for their substance use disorder while they're living on the street, and you can't ignore their behavioral health issues when you're treating their substance use disorder. And all of this needs to be looked at by the physical health system on parity, right? We need to start looking at behavioral health like we do heart disease, like we do sort of other kind of long-term managed care for people, because that is people are getting sick from their mental health physically, and we will treat the physical piece of this, and yet we're not treating the behavioral health piece that might cause them not to go into the hospital. So if we think about the system as a whole, I think I want us to really start looking at that across the systems. That's going to take money. That's going to take courage. That's going to take what's the term, BHAG? The big, hairy, audacious goals. It's going to take that whole thing to push us forward. And I bet you there are people in this room right now who could get together and do that. And we're open. We're ready. This legislature, the legislators that are here want to hear them, and we want to have those answers. We don't have all the answers. You guys are the experts. So that's what we want to do, is this partnership with you.
Senator Anderson, let me just give you a chance to follow up on that from your perspective, also on the interim committee related to mental health. There's a lot built into the conversation we've had here. Let me just give you an open opportunity to respond.
Yeah, I think that's, I'm agreeing with Senator Libra, as I usually do.
Good job.
But and some of the pieces that you were talking about, the reimbursement piece, again, for rural and coastal, and the different silos get reimbursed differently. Mm-hmm. And I can remember the debate we had over, reimbursements around telehealth. And it's just, again, from that rural coastal perspective, I need my constituents, my people, Oregonians on the coast, need the services. And we need to find ways that, are attractive for the professionals to bring their product, so to speak, to the coast and to rural areas. And, that might be, we talked about nurse practitioners, we talked about dental therapy, we talked about, telehealth, and these are all ways. But again, all they are kind of Band-Aids without the reimbursement level coming up and an attractiveness of compensation for the workforce to be in these areas. Because I got to tell you, at different committee meetings or sessions that we would, as we all are experts in the field the minute we get elected, I found it interesting that we'd start talking about how many visits, special in behavioral health, someone should have with a psychiatrist or therapist or somebody. And I'm sitting there saying, my people would just like to have one, without having to travel. So we've got to do a better job of finding that component. That it's incentives, it's a well-paying jobs that are, and much, Senator Libra, to your point, the whole picture, the whole component would make it work.
Yeah. So let me ask you a follow-up on that, Senator Anderson. Certainly in a number of Oregon's rural counties, when you add the school district and the county, and then whatever state employees may be in the county, it's public employees that are often the largest group of employed folks in the county. And of course, their jobs are paid for by tax dollars. When you talk about reimbursement, on the one hand, rural counties need more providers, and reimbursement, to your point, is often not high enough to attract folks into those rural counties. On the flip side of it, a higher tax rate or a higher tax rate that would allow for local government to pay a higher reimbursement to attract folks could be seen as a drag on local economies that have already been suffering, particularly out on the coast and other places in rural Oregon. How do you sort of strike that balance between one side that's arguing, particularly amongst Republican colleagues, who are arguing on the one hand, we need more reimbursement to get more professionals in our communities, and we need lower tax rates to drive economic development? It's a tough discussion to balance.
Well, it is. And I think there's where and why we're all elected in the positions we are to make those tough decisions. To me, it's about priorities. And you have to decide. But you're right. We just can't keep taxing, because I can tell you, without even looking at it, I'm betting the coast as a region, has a lower median income, as a group than other parts of the state. And so if they're not on Oregon Health Plan, if there's deductibles, whatever, it still comes out of they're generally going to the emergency room and not having a deductible, or ending up having to file bankruptcy or do something because of the debt. And so it's about priorities, what's important. And if overall healthcare is a key component, as I believe housing is, as I believe childcare is, then we have, as a group, have to decide that's where we put a subsidy. And I don't mind saying it. I think you have to, depends on what we need. And now I would ask to see results, quite frankly, not just do it, but I want to see that it has the impact that we thought it would, and that we are making progress in the right direction.
And DJ, if I might, and I'm going to just play off what Senator Anderson said, we're not going to tax our way out of this problem. It's too expensive. What we need to really do is get sort of reimbursement rates up for our Medicaid, Medicare, which will drive private insurers to pay more as well, right? I mean, we need to understand that this system isn't about how much we as the state is necessarily spending, even though we know we have to spend general fund dollars to get that Medicaid, Medicare match. But, we got to balance our budgets. And the federal government, as everybody is realizing, apparently doesn't have to. But we got to balance our budgets in a way that is really profound. But if you think about healthcare, and I think this is where we're going to this isn't about Democrats or Republicans or whether we're taxing or not. This is about looking at people and saying, if we make ourselves healthier as Oregonians, we will cost ourselves less. If we invest in behavioral health, substance use disorder, we house people, they're not going to get into the criminal justice system in the profound ways that they are. If we allow people to have good paying jobs and we make them healthy and allow them to have healthier lives, they're actually going to cost us less when they do get older. So if we can turn this on its head and look at this as a way for saving, in some ways less, costing us less, it's not only the right thing to do from a humanitarian standpoint, it will, from an economic standpoint, begin to pay off. And
I think we may have lost you there, Senator Libra. It looks like you're frozen on my screen.
She froze. And if it's okay, what Senator Anderson was saying, it prompted me to think similarly on the lines of reimbursement and livable wages. And so if I could take a second just to give that example of, as a provider, what it is like. So when you serve or care for our aging population, the reimbursement rates for Medicare is so low. Having that practice is really challenging. So the work that I do going into long-term care facilities to care for people, a lot of other organizations or systems that have set up to do this, because the reimbursement rates are low, stop. So then who is caring for our homebound seniors and those with behavioral health issues? So as a nurse practitioner, we fought for that parity a while ago. Now we have behavioral health providers fighting for that parity. So this reimbursement is so important, but also because the wages we pay our workers are so important. And the things that we watched over during the COVID pandemic is long-term care providers, organizations having to actually pay a livable wage job to keep their caregivers. And I will say it time and time again, we have to start treating them like the professionals that they are and pay them what they deserve and have them also have health care. We can't have our frontline healthcare workers providing care to our most vulnerable at low wages. And then we also can't have these most needed services, behavioral health and primary care, being reimbursed at low rates. And I really think when we get there, we're going to improve access and outcomes by focusing on prevention, using that public health model. How do we focus on prevention?
Representative Moore Green, you've been very patient. I want to give you an opportunity to respond to any of this that you've heard in the last few minutes.
Well, thank you, DJ. And I just so enjoy listening to the conversation. And there are actually 3 items that I just want to touch on. It might be more by the time I get done, but Senator Libra and Representative Prusak both spoke about healthier Oregonians. And one of the conversations that I've been having is, what are the things that we can be doing upstream for Oregonians to help them have a healthier lifestyle? And I do think that the pandemic has shown us that if and when we have underlying health conditions, it does complicate our ability to fight any sort of additional cold or a flu. The resiliency is not there. And so I have, along with some local community partners, we're working on some legislation that will talk about the upstream, education, preventative, maintenance, maintaining your health. And part of that does go to the ability for a family or an individual to have not only their physical health addressed, their mental health, but their oral health as well. We know the stories of the kids who have got cavities and they're in pain. They can't sit through a class. They need help, right, to alleviate that pain. So that's healthier. I think that should be actually one of our top priorities. If we want to bring the cost of healthcare down, we need to invest in preventative and maintenance and education. Workforce. Here again, what are we doing for our workforce to invigorate it? Met with a local the Willamette Academy Center, which is one of our new CTE centers here in Marion County that services Marion, Polk, and Yamhill counties, and talking with one of their developers this morning about the healthcare programs that they're starting. So we've got high school students who are doing real-time work, clinical work that they actually will come out being able to be employed directly into the workforce. Now, and this is a pathway to a longer career that they can build on. So here you come out of high school, you don't have any debt, you're living locally, right? You've stayed in your community, and you have an opportunity to work in some very meaningful ways in healthcare, and you can continue your education and work through. So I think that is very important. And then I want to go back to silos, what Rep. Libra touched on, especially within the behavioral health arena. And DJ, one of the things you asked before we got started, what are we spending our time on in the interim? And I made a commitment, not only to myself, but to my caucus, that I would follow the work that has come out of Senate Bill 755, which is the statutory implementation of Measure 110. And it's very important to me, with the amount of money that we invested overall as a state was $500 million into behavioral health, of which approximately 200,000 is addressing and putting into place the mechanisms that will make Measure 110 come to fruition. But in the course of doing that, I think it's really important that we understand that some of the things that we're doing with that money not be duplicated with the other money that we put out. So for instance, if we need a sobering center in let's say Tillamook, let's make sure that money that's coming in is being invested wisely, and that it will meet the statutory needs of Measure 110, but it will also meet the community needs, the greater community needs within our state, and especially in our rural communities, because I think what we're seeing with the statistics of Measure 110 is Southern Oregon is suffering greatly at the moment, and need to make sure that here again that our resources are spread evenly, or not evenly, but to the communities that are affected the most. There were a couple of other bills that we had out of the Healthcare Committee this session that I thought really spoke to not only some of the lessons learned from COVID, the early lessons, and one of them was the telehealth bill that Rep. Prusak and I both worked on, and that was a very important piece of legislation, and specifically within the behavioral health realm. That was something not perfect, but definitely a move towards access. And then the other one was the PA modernization bill that was passed, and here again, reducing restrictions and allowing PAs to practice with greater flexibility, which takes some of the pressure off both sides of your providers. So as I said, I could go on forever, but I'll stop there. So thank you.
That's good. I want to give you a chance. I know we're out of time. Representative Moore Green, that was good stuff. I want to give each of you an opportunity, and sadly we have, I think, lost Senator Libra, but the three of you who have been steadfast and are still with us, I want to give each of you the opportunity to tell us what you're hopeful about. What gets you out of bed in the morning when you think about healthcare reform, about health policy, and the work that you're doing. So when it comes to health policy reform, Representative Moore Green, will have you start. What gets you excited? What gets you hopeful? You're on. There we go. Go ahead, Representative.
Thank you. What gets me hopeful? The one story of somebody's life that has been changed because we've been able to deliver services that have affected their ability in the behavioral health realm, perhaps to cope better, to manage their life better. It's the single stories.
Yeah, good that those are, the impacts you're having on people's lives. That's why you do it, right? Senator Anderson, how about you? What gives you hope?
Yeah, excellent question. I guess I don't want to lose the fact of accountability, and one of the things that we really need to do is, measure and hold agencies accountable and see the results of our actions. This has been a big learning curve for me, though. Certainly local government, as I said before, I've seen the connectivity between not having something, i.e. whether it's dental health or, overall physical health, mental health, housing, they're all connected to, kind of the woes of a community, and of which costs the community a lot more money. So I'm on that learning curve. I've gotten into this. I've served purposely on the North Lincoln Health District, and as I said earlier, some of the Senate committees and work in task force, universal healthcare task force. So I'm on a sharp learning curve to see what are some of our options, and I know there's a lot of connection. And can make our constituents and citizens healthier and more prosperous.
Representative Prusak, I'll give you the last word. What gives you hope when you think about the work ahead of you on healthcare, health reform, and health policy?
Thanks. Well, I keep trying to look for the silver linings of this pandemic because I know we're all exhausted. Everyone on this call, whether it's administrators, CEOs, payers, hospitals, providers, we have had a really challenging 18 months and we're all exhausted. But I keep thinking about the silver lining of that, which is the curtains have been pulled back. Things that those of us that have been working in it for a long time are now exposed. And now we have this opportunity to really invest in transformation, making sure everybody has access and making sure that we have our nurses at the bedside and everyone at the bedside really focused on a trauma-informed approach to how we get back on track and take care of each other and take care of our communities.
Great stuff. Representative Rachel Prusak, the chair of the House Interim Committee on Healthcare. Representative Raquel Moore-Green, the vice chair of the House Interim Committee on Behavioral Health. Senator Anderson, who serves as the vice chair of the Senate Interim Committee on Human Services, Mental Health, and Recovery. And of course, the Senate Assistant Majority Leader, Senator Kate Libra. Thank you guys all for making time to be with us. I appreciate it. And to you all who have stuck with us today and continue to put wind in our sails here at State of Reform, thank you for being in our audience. I am hopeful we will be doing this in person at, either the Portland Marriott or the Portland Hilton next year. And we are honored to play this role. So thank you for allowing us to do it. We'll have many of our conversations. Of course, all of our conversations will be available for you all to come back and watch on demand through this site. We will post some of them online for others to view. And if you have any questions or if we can help you in any way, feel free to email me directly, djwilson@stateofreform.com. Thanks, and we'll see you next year.